It's interesting to me, there's two groups that are out there, or two entities that are out there that think you're wrong, or sort of think you're wrong.
I'm sure they're more than that.
No, right. But sort of wrong in the underlying premise. And you've demonstrated a certain amount of humility on we've got to get it right, and I respect that. But it's interesting, the Lewin Group, the study that I'm sure you're familiar with, says it's not going to happen. And 120 million folks are going to be out of that out of a private plan. And the other is one of my colleagues from my delegation, Representative Jan Schakowsky. Let me read a quote, and I'm interested in how you reconcile these two views in the brief time that we have. This is Representative Schakowsky's quote on April 18th, speaking to a group of single-payer advocates. She said, "I know many of you here today are single-payer advocates, and so am I. And those of us who are pushing for a public insurance don't disagree with this goal. This is not a principled fight. This is a fight about strategy for getting there, and I believe we will." In other words, this part of the plan is part of a prelude toward ultimately a large single-payer plan. Can you debunk that? Can you reconcile those?
Well, again, Congressman.
Very difficult, Madam Secretary, for you to respond to a statement attributed to a member, but I'm certain that the question could be refrained without responding to a member and asking whether or not she believes that this is the beginning of single payer. But I don't think it's fair, since Congresswoman is not here, to say whether or not she ever said it.
Okay, that's fair enough. What is it a prelude?
I don't think so, Congressman. Again, I would point to the fact that these strategies, competitive strategies, are effectively in place across the country. They're not a prelude to anything other than offering consumers choice and driving competition based on practice models. So it's determined by the plan design. Can you construct an unlevel playing field with a public option unfairly competing with private options? You bet. Is that the intention of the administration or the majority in Congress when they talk about it? I don't think so at all. So it can be designed any number of ways if you have the right actuarial support, if you design the rules so there really is a level playing field, that private insurers don't have the advantage of cherry-picking the market and the public plan doesn't have the advantage of undercutting the costs and driving everybody out. It can work very effectively and does work very effectively across this country.